Imagine a world where you could command the digital realm with the power of your mind alone. No keyboards, no touchscreens, no spoken commands, just a thought, and the lights in your room dim. Another thought and music begins to play, a symphony composed by your own silent intentions. This is not, a scene from a distant science fiction epic. It's actually the tangible future being built today. A future where the boundary between human consciousness and artificial intelligence begins to dissolve. We stand at the precipice of a new era, one that promises to redefine what it means to be human, to interact with our world, and to connect with each other on a level we've only ever dreamed of. This grand and audacious vision is championed by a name familiar to those who follow the trajectory of human ambition: Elon Musk. He's a figure who has consistently pushed the boundaries of what is possible, from electrifying our transportation to setting our sights on the red sands of Mars. With Neuralink, Musk turns his focus inward, to the most complex and mysterious frontier of all, the human brain. The project is not merely about convenience or technological novelty. It's driven by a profound and perhaps urgent purpose: to ensure humanity's place in a future that will be increasingly dominated by artificial intelligence. At its core, Neuralink is a brain-computer interface, or BCI. It's a device, a tiny, sophisticated chip, designed to be implanted directly into the brain. This chip acts as a bridge, a translator between the electrochemical signals of our neurons and the digital language of computers. Its goal is to create a seamless, high-bandwidth connection between our biological minds and the vast, powerful network of artificial intelligence and connected devices that surround us. The implications are staggering, stretching from the restoration of lost functions to the enhancement of our innate abilities, forcing us to contemplate our own evolution. The central idea is one of symbiosis. Musk has often spoken about the potential threat of a runaway superintelligence, an AI so advanced that it could leave humanity behind, like we left our primate ancestors. Neuralink is proposed as a solution, a way to merge with AI, to augment our own intelligence and keep pace. By linking our minds directly to the digital world, we could potentially access information as quickly as we can think it, learn new skills with unprecedented speed, and solve problems that are currently beyond our cognitive grasp. It's a bold, proactive step to guide our own destiny in the complex dance with the machines we create. The story of Neuralink began not with a grand announcement, but in the quiet corridors of innovation. The company was founded in secret in 2016, a skunkworks project that brought together a team of brilliant neuroscientists, engineers, and roboticists. For 3 years, they worked away from the public eye, laying the foundational groundwork for one of the most ambitious undertakings in human history. The world was, for the most part, unaware that a team was actively designing the technology to read and write information directly into the brain. This period of quiet, intense development was crucial for tackling the immense scientific and engineering challenges that lay ahead. Then, in a highly anticipated presentation in 2019, the curtain was lifted. Elon Musk stepped onto a stage and introduced Neuralink to the world. He revealed not just the concept, but tangible progress. The presentation detailed the company's mission, showcased the initial designs of the implant, and, most impressively, introduced the surgical robot designed to perform the delicate procedure. It was a moment that captured the global imagination, transforming the abstract idea of a brain-computer interface into a concrete engineering project. The world saw that this was not just a theoretical pursuit, but a serious, well-funded effort to make science fiction a reality. The device itself, known as the Link, is a marvel of miniaturization. It's a small, coin-sized chip designed to sit flush with the skull, making it cosmetically invisible after the procedure. From this chip, an array of ultra-thin, flexible threads, each one thinner than a human hair, are designed to be inserted into the brain's cortex. These threads are packed with electrodes capable of detecting the tiny electrical spikes generated by neurons. The sheer density of these electrodes is what sets Neuralink apart, promising a resolution of brain activity far beyond what previous technologies could achieve. This high-fidelity connection is the key to its potential. The implantation process is as futuristic as the device itself. Recognizing that human hands lack the necessary precision for such a delicate operation, Neuralink developed a specialized surgical robot. This machine is designed to meticulously insert the flexible threads into the brain, avoiding blood vessels with microscopic accuracy. The goal is to make the procedure as safe, quick and routine as something like LASIK eye surgery. The robot's precision is paramount to minimizing tissue damage and ensuring the successful integration of the device, turning a once daunting neurosurgical procedure into a streamlined, automated process. The magic of Neuralink lies in its ability to listen to the symphony of the brain. Every thought, every movement, every sensation begins as a pattern of electrical signals fired by neurons. The microscopic electrodes on the device's threads are positioned to eavesdrop on this neural conversation. When a person even thinks about moving their hand, a specific group of neurons in the motor cortex fires in a distinct pattern. The link chip detects these signals, and its sophisticated algorithms decode them in real time. It translates the intention, the thought, into a digital command that can be sent wirelessly to an external device, like a computer or a smartphone. This remarkable capability was first demonstrated to the public in a truly memorable way. In 2021, Neuralink released a video of a macaque monkey named Pager. Pager had a Neuralink implant and had been taught to play the classic video game Pong. Initially, he used a joystick to control the on-screen paddle. As he played, the Neuralink device recorded the patterns of his brain activity associated with moving the joystick up and down. After this calibration period, the joystick was disconnected. Pager continued to play the game, controlling the paddle perfectly, using only his mind. It was a powerful, undeniable demonstration of the technology's potential. Thought had been translated directly into action. The journey from animal trials to human application marked a monumental step for the company and for neuroscience. In early 2024, Neuralink announced it had successfully implanted its device in the first human participant, Nolan Arbaugh, a young man paralyzed from the shoulders down due to a diving accident. For years he had been unable to interact with the world in the way he once had. With the Neuralink implant, however, everything changed. He regained the ability to control a computer cursor simply by thinking, allowing him to browse the internet, play online chess, and reconnect with the world in ways that had been lost to him. Nolan's story is a testament to the profound medical promise of this technology. He described the experience as akin to using the Force, a seamless extension of his will into the digital space. The success of this first human trial opened the door to a future where paralysis may no longer mean a life of disconnection. It provided a powerful glimpse into a world where technology could restore not just movement, but autonomy and hope. The ability to bridge the gap between a healthy, active mind and a body that can no longer respond is perhaps the most noble and immediate goal of this groundbreaking endeavor. The initial focus of Neuralink is, rightly, on medicine. The potential to help those with neurological disorders is just immense. Imagine restoring movement to people with spinal cord injuries, giving a voice back to those who have lost the ability to speak due to a stroke, or even treating conditions like blindness and deafness by feeding sensory information directly into the brain. The technology could also offer new ways to tackle intractable mental health issues like severe depression or anxiety by helping to regulate neural circuits. For millions of people living with disabilities, Neuralink isn't about enhancement, it's about restoration. It's about regaining a fundamental quality of life. But the vision for Neuralink extends far beyond the therapeutic. Once the technology is proven safe and effective for medical use, the door opens to the world of human enhancement. This is where the conversation shifts from restoring function to augmenting it. What if you could learn a new language or a complex skill, like playing the piano, by simply downloading the information into your brain? What if you could connect to the internet with a thought, accessing the entirety of human knowledge as an extension of your own memory? This is the territory of transhumanism, the idea that we can use technology to transcend our biological limitations. This future, as exciting as it sounds, is filled with profound ethical questions that we must confront as a society. What happens to our concept of mental privacy when our thoughts can be recorded, stored, and potentially accessed by others? Could our brains be hacked, our memories altered, or our actions controlled by a malicious actor? The security of a brain-computer interface is not just a matter of data protection, it is a matter of personal identity and free will. We must consider who owns the data generated by our own minds and what safeguards need to be in place to protect our innermost selves. Furthermore, the advent of cognitive enhancement could create a new and profound form of social inequality. Initially, technologies like Neuralink will be incredibly expensive, accessible only to the wealthy. This could lead to a future divided not by wealth or status but by biology itself, a world of the chipped and the unchipped. Would an enhanced individual have an insurmountable advantage in education, employment, and life? What does it mean for the unenhanced? And what are the implications for children? Should parents be allowed to make the decision to enhance their child's brain? These are not easy questions, and they strike at the heart of our values. The rapid pace of development in the field of brain-computer interfaces is, honestly, undeniable. What was once confined to the pages of speculative fiction is now happening in laboratories and, indeed, in the brains of human volunteers. Neuralink is not alone in this race. Other companies and research institutions around the world are also pushing the boundaries of neurotechnology. This global competition ensures that progress will likely continue to accelerate, making these profound questions ever more urgent. We must also consider the legal and social frameworks that will be needed to govern this technology, from defining new rights to privacy to regulating its use. The ultimate promise dangled before us is a form of digital immortality. If our thoughts, memories, and consciousness are fundamentally patterns of data, could a sufficiently advanced BCI one day capture the essence of who we are? Could we upload our consciousness to the cloud, allowing our identity to persist long after our biological bodies have failed? This is perhaps the most far-reaching and philosophical implication of all, blurring the line between life and death, and between the human and the artificial. It forces us to ask a fundamental question: what part of us is truly us? Is it our flesh and blood, or the data our brain processes? As we stand on this technological frontier, we are faced with a choice that will define the future of our species. Is this the next logical step in our evolution, a tool that will allow us to overcome disease, expand our minds, and reach for the stars? Or is it a Pandora's box, a technology that threatens our freedom, our privacy, and the very essence of what makes us human? The potential for good is extraordinary, offering hope and healing to millions. Yet the potential for misuse, for control, and for societal division is equally real and must be navigated with wisdom and foresight. The cosmos has brought us on a long journey, from single-celled organisms to beings who can contemplate their own existence. Now we are developing the tools to consciously direct our own evolution. The decision of whether to embrace this path and how to do so responsibly falls to us. So the question is not just for scientists or philosophers, but for everyone. Would you agree to have a chip implanted in your brain? Is this the ultimate expression of human progress, or a step too far? The universe is watching, waiting for our answer.